She'd rather we didn't name or identify her, so let's call her Hawa. She's one of the many women in the Somali capital who are HIV positive. Like others, Hawa covers her face when she leaves the house, especially when she goes to the hospital to collect her antiretroviral drugs. There are no exact figures for the number of people living with HIV/AIDS in Somalia, and it's not easy living in a society so full of stigma.
The government has no idea how many people are living with the disease. We need special medication, we need a separate hospital because we face constant stigma from other members of society. Even at the hospital, we feel threatened, always.
Activists have gathered here to show their support for Hawa and other people living with HIV/AIDS. This center provides counseling, but says patients need far more than psychological support.
They come here to us. They tell us their family members don't want them. We offer them emotional and psychological support. We tell them that they are just like other people who suffer from diseases. But the awareness needs to extend beyond hospitals, to schools, mosques, and other learning centers.
In such a conservative society, many Somalis have been forced to hide their HIV status. But latest research shows an increase in infections. It's now prompted healthcare experts to call for a nationwide campaign aimed at young people who are identified as the most vulnerable group. Banadir Hospital is the only health institution in Mogadishu that provides HIV care and treatment. It's facing serious financial challenges and wants other health institutions to open their doors to those affected by the virus.
ARVs we distribute to HIV patients are provided by UN agencies. If they stop supplying us, then we'll have to treat patients. We need more support. These patients need our support.
Authorities too have come under criticism for failing to address HIV patients' needs. However, the government maintains it's committed to helping people living with AIDS.
As the Ministry of Health, we are ready to address these grievances. We want HIV-positive people to come together, form organizations that will advocate for their rights. We will do everything in our power to make sure that their needs are met.
But Hawa and her friends want more than that. They want authorities to offer employment opportunities to people living with HIV/AIDS to break the silence and lift the stigma. Abdulaziz, Billow, CCTV, Mogadishu, Somalia.